You're live in just about 10 seconds.
Well, welcome everyone. My name is Louis Rickey, and I'm Executive Director of the Indiana Arts Commission. I am sitting here in my office. I am a white male, older, and I'm wearing a blue and purple plaid shirt. And it's great to have everyone with us today. As public health guidance around COVID-19 evolves, it can be difficult to know how to proceed with programming events and regulations around masking and vaccinations. We are so lucky to be joined today by the Indiana State Department of Health's Chief Medical Officer, Dr. Lindsay Weaver, who will be answering the questions submitted by our attendees. Thank you, Dr. Weaver, and also to those of you for watching and for helping to make sure that arts organizations and venues are adhering to the best public health practices available. If you submitted a question when you registered for this webinar, we've kind of compiled those and we've got those ready. If you're watching on YouTube, you can add a comment to the chat on the right. We'll make sure we try to get to those if time permits. So without further ado, Dr. Weaver, please introduce yourself and give an audio description of your appearance.
It's afternoon now. Yes, good afternoon, everybody. My name is Lindsay Weaver. I'm the Chief Medical Officer here at the Indiana Department of Health and have been assisting and leading the COVID-19 response from the state since COVID started. I am sitting in my office. I am a white female, and I don't think you can see my shirt, but it's black.
Well, Dr. Weaver, thanks again for joining our sector for the webinar to provide some health guidance, and we're lucky to have you. We received a lot of questions from arts organizations and venues when we opened the registration. Again, we have summarized some of those, and why don't we dive right in and get to them? So to start off, what is our current status? Is it similar to where we were at last year's peak? And how is it similar and how's it different?
So it's kind of hard to compare the peaks, honestly. So we're definitely in a different spot. The Delta variant behaves differently. We see it spread much faster than we've seen the original wild type of the SARS-CoV-2 coronavirus. Or any of the variants that we've seen since then. So it seems to be where it is spreading much faster. So we're seeing a more sharp turn in our number of cases. So today we're reporting 2,800 cases, which is down. But to remind you, this is all about when we receive the test results. And so after a holiday weekend, there is typically a delay in us receiving test results, also a delay in learning about hospitalizations, and also a delay in us learning about death. So we typically see a more accurate number in the middle of the week. So like Wednesday and Thursday, we'll start to see kind of more of those numbers come in. We've been paying really close attention to some of the states around us who started to peak early, because that gives us a little bit of knowledge about when we can expect that we're reaching our peak. And based on looking at, for example, Missouri and Arkansas, Louisiana, who started on their increase in cases and spike several weeks earlier than us, we would be expecting to peak here in the next couple of weeks. Now, that's a peak in cases, right? I think the thing that we are most worried about is the peak in hospitalizations. Our hospitalizations are already very stretched. Our hospitals are very stretched right now. And to think that those hospitalizations are going to continue to rise several weeks after our peak, it's a thing that we are honestly most worried about. So lots of information. I think the other thing that's different now is that people's testing habits changed throughout the pandemic. So early on, remember, we could hardly find a test. And so when tests became readily available, everybody was running to get tested if they had a little bit of a sniffle or, went to the grocery store and they were worried maybe somebody was coughing in the aisleway. And then we saw that, that demand for testing significantly go down. And then after vaccines, people were like, oh, I'm vaccinated. This little sniffle's probably allergies. And so maybe less likely to get tested. And then at the same time, we see a lot of kids flooding in to get tested too. So there's all sorts of factors that go into this, and why it's kind of hard to compare peak to peak when you're just looking at cases or testing, et cetera. So it's really those hospitalizations that we continue to monitor.
What are some of the precautions that you recommend arts organizations and arts-based businesses take to keep people safe? And that could be in the areas of masks, vaccinations, temperature checks, ventilation, social distancing, all of the tools, I suppose, that we've had at our disposal that we've developed over the last year and a half or so. And again, especially given the nature of the variant that is afoot here.
Yeah. So I think the important thing to remember about that, all of these things really are tools, right? And so, and they do layer on top of each other. Just to kind of call a couple of them out, for example, temperature checks. We haven't found temperature checks to be profoundly helpful. Clearly people take Tylenol, ibuprofen, that brings down their temperature. And so it'd be falsely low. We've had people, if they're standing outside in a line in the sun, then that makes your forehead hot. And so it's falsely elevated. And honestly, we found the people who've been taking the temperature to be at risk because they're exposed to so many people coming through. So we haven't really found that to be especially helpful, and honestly more of a burden than helpful. It is always important to ask people or remind people, do not come here if you're sick, if you've been exposed, right? People need to be staying home. But I think people know that now, right? So we've been talking about this for a while now, so they know they should be taking those precautions, so they either are or they're not. And because of that, people have to mask indoors right now. That is the recommendation from the CDC. The reason being is that unfortunately, even people who are vaccinated, could be getting this variant, especially, and then be spreading it and be completely asymptomatic. So your temperature check would be negative, their symptom check would be negative, and maybe they just haven't developed symptoms yet, or maybe they're an asymptomatic carrier. And so the only thing you really can do to help prevent from spreading the virus is to mask in those indoor settings, especially where it's, really closed in, or people have to, or you can't do social distancing, right? So social distancing is another important measure, right? The most space people can get in between each other, especially people who are outside their family unit or outside of their, group of people who they typically are exposed to. Is really important as well. Anything and everything you can do outdoors is my recommendation right now, right? That is the best ventilator system we have. The weather is nice. This is the perfect time of year. So whatever you can do and do things outdoors is great as well. As far as like eating, types of things or whatever, again, people seated, of course, they're going to have their masks off, and eating and drinking and types of that type of thing it is what it is, right? Try to keep as much space in between tables, etc. I kind of caution people against any kind of like mingling, cocktailing type of things, because then again, it's a bunch of people not wearing masks and kind of walking around each other. And the most important thing is people know their risks. If you're high risk, if you're, over the age of 65, if you're immunocompromised, if you live with someone's immunocompromised, then you should be thinking about the risks that you're taking, right? And maybe not avoiding situations like that until we get, to the other side of this peak.
I'm on mute, of course. Would you even just talk a little bit more about maybe the Delta variant and how that plays into what you just summarized as far as it being slightly different in nature than the original COVID-19.
Yeah, so we found with the Delta variant that it's 2 times more transmissible than the other variants in the wild type. So before, when you would one positive person would potentially spread to 2 or 3 people, now it's 4, 5 people, 6 people. And that just makes it get around more. So higher viral load, so more of that replicating virus in your nose, and spreading it around more easily to people. And again, unfortunately, that includes vaccinated people who who have not had COVID before. We still see really low reinfection rates. Not that we're not seeing some reinfections, we are, but still really, really low. But vaccinated people are at risk. I think the important thing you have to remember, though, is that the vaccine is still very important because it is definitely preventing hospitalizations and death. I mean, the difference between everyone who is hospitalized that's unvaccinated versus vaccinated is vast at this time. So still very important, but I do think people have to realize that doesn't mean that you're not at risk for getting the virus and then potentially spreading it to someone who is at risk.
Why don't you talk a little bit about maybe performers, musicians who cannot wear a mask while performing? What precautions can be taken to ensure safety? And obviously, does vaccination status impact this? And how should arts organizations deal with the performers who may need not to be masked?
Yeah. So of course, number one, the only thing we have right now to truly, prevent significant illness is vaccine. So vaccinate, 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 vaccinate. And then, from then on, it's social distancing, right? So as much as you can maintain space, and that when people are close, that it's for a short amount of time. Again, ventilation, if you can open up to the outdoors or make sure that your HVAC system has very frequent air changes. So, how often is the air changed in a room or a space every hour is important. Every additional, movement you can get of the air is really, really helpful. I think that we're in a place where we know that we're going to be living with this virus for some time. And so there's no expectation that all times are going to be perfect. But as long as you put in as many of those layers as possible, right, to help prevent disease. And I think especially during like the high times right now where the virus is really, really high, that we do need to kind of think about when we're planning for the future, is this going to potentially be during a peak time? Would we change things versus a time where there's less virus spreading around? Because it does make a difference.
Well, what are some more of your recommendations about events with food? You said that probably the cocktail format is not the best format. Other things that folks should be thinking about?
Yeah. And again, that's just more, it's just more people that you're potentially being exposed to as you're moving around. That, of course, unmasked if you're doing cocktails or hors d'oeuvres or, the past hors d'oeuvres type situation. I think also, it just spacing, making where people can be as spaced out as possible. But then any situation where you're having food, that more sit down type where they're, even if they are kind of sitting close-ish to people that they could be getting exposed to, it's only a couple people instead of 10 or 20 people that might be mingling around.
Great. If someone's been asked to quarantine by a school or an employer, what are arts organizations saying to people who may have wanted to attend events during the quarantine? Is it best to consider those people differently than maybe other patrons?
If you are considered a close contact, so you've been around someone who has COVID, then you should stay home, right? Those people cannot be going out and about. You can develop symptoms and therefore become contagious at any point along the 14 days. Most people, it's within the 5 or 6 days that they become symptomatic, but definitely there's people who were exposed 14 days ago and become symptomatic and therefore could be transmitting up to 48 hours beforehand, up and all the way up to that 14 days. I think another important thing here to outline is that if you are vaccinated and you're a close contact, that you don't have to quarantine, you don't have to stay home. But the ask is, again, especially with this variant that we're seeing that's so transmissible, that you do wear a mask during those 14 days after your exposure, and that you get tested at 3 to 5 days after your exposure, just in case you're maybe an asymptomatic positive or about to become symptomatic.
So some performing groups have been requesting that people have negative tests to be backstage or with performers. And because of that, some quicker turnaround for a test needs to be administered. What are the best routes for obtaining a test and a quick read response to the test?
Yeah, so testing is really strained right now. I mean, really strained. We've seen this happen before during other peaks where it's just a lot of people going in to get tested. And again, with school back in, and a lot of the schools, the CDC allows different levels of quarantine. I probably should have mentioned that last time too. So if you are unvaccinated, you've been exposed, the CDC has come out and said that you can do your 14 days quarantine. So just, 14 days at home, and then you can return to the world as long as you haven't developed symptoms, or you could do 10 days. And that's kind of a little bit more at risk because it could be those several days. You should still be monitoring for symptoms, but 10 days, the vast majority of people would have become symptomatic during that time. Or you can do a test on day 5, 6, or 7. And as long as that test is negative, then you can come out of 14 on day 8. So because of that, my whole reason behind describing that is that a lot of schools are allowing kids to get tested to come out of quarantine to come back to school on day 8. And so there's a huge flood of students, so K through 12 people going to get tested right now, and they too are looking for that rapid test. They are sold over the counter at pharmacies. Be hard pressed to find it. Honestly, I don't love the home tests. It's hard enough for physicians and nurses to get a good sample, let alone for you trying to get a good sample of yourself at home, and then make sure that you do the test the right way and you wait the right amount of time, et cetera, et cetera. As an ED doctor who's taking care of lots of pregnant patients, it's very similar to a pregnancy test, which people unfortunately mess up and get wrong all the time too. So I don't recommend the home test, but they are available and they are quick. Some of our pharmacies do offer quick testing. Those are also hard appointments to come by. The Department of Health does drive-through testing across the state. We're at up to 50 different locations every week that we go around the state to provide testing. We do offer the rapid test there, but again, it's kind of we're going to where the infections and the outbreaks are. So all that to say is that it is difficult right now. Plus, the makers of these rapid tests are behind on manufacturing because there's so much use for that right now. I would like to also speak to the places that have that rule is that, we have unfortunately found when people are like requiring negative tests to do something, that then they behave as if they're negative, right? Which is a worry from our standpoint. We should always be behaving as if we're positive. And that test is only as good as it was literally that second that they got it done, right? They can become positive 3 hours later, 6 hours later, 12 hours later, 24 hours later. And so it's, it makes us feel better. But really we should just all be acting like we're positive and taking the right precautions.
I think that probably answers the next question, which was how long should a negative test be accepted? And the answer is just for the moment, right? It's just valid for when it happened, and obviously you could be exposed a minute after, right? Or just make enough virus for it to become positive. I think another thing to remind people is that the gold standard, the PCR test, so the test that they do and then send to the lab, and it takes a couple of days to get back. That's the best test we have. And 30% of the time when someone's positive, it'll come back negative. So 30% false negative. Those rapid tests, even higher false negative. They're performing better with this high viral load variant that's out there right now, but still upwards of 40% false negative right there. So again, even if you got a negative, that doesn't necessarily mean that you're not positive, right? It just could be a false test. I'm going to go to one that just got posted. I'm coordinating a 40,000 plus attendance 2-day outdoor festival this fall. What are reasonable outdoor event best practice recommendations?
I think reasonable is, it's spacing really between your vendors and the people that are visiting, allows space between vendors, right? So that they're not all cramped up on each other so they can be protected. Again, they're the most at high risk, right? Because they're getting exposure over and over and over and over again by all these different people compared to people who are coming to visit it, who likely will just kind of stay with the group that they came with, right? Or maybe might intermingle with a couple other people, but not, 40,000 different people coming up to them over again. So just really encouraging space. Again, hand sanitizing is always great. I would definitely encourage mask wearing for the vendors who are going to be seeing all of those people. And then, just signs reminding people that COVID is here, and, don't come in if you have symptoms. But I think, we probably all know these things by now. But the fact that it's an outdoor event, really have not been able to trace back huge outbreaks to outdoor events like that. So I think that, has been really, really encouraging. Where you've heard of outbreaks, like, for example, Sturgis, you heard of an outbreak there. Well, those people are like meeting in bars and hotels and everything else, whatever. So even though that's like technically outdoor, we don't even really consider that like an outdoor kind of super spreader event. We just really haven't seen it because, like I said, it's the best HVAC system you can have.
So going back to one of your comments there, someone also asked, what is the obligation with public health for contact tracing? So if a performer or a vendor would test positive and inform you as the event organizer that yesterday when your event was happening, I found out that I was positive, should audience be advised? Should only people possibly that were in close contact with that person or vendor or performer? How would you deal with that situation?
Yeah, that's a really, really good question. I think definitely the person that person was working with and around for extended periods of time. Most of the time, vendors, it's a quicker interaction. Just kind of thinking off the top of my head, the people I'd be worried about would be like a face painter, someone who is actually in someone's face for a longer period of time. So that might be something to, consider about how would you notify people in those types of instances. But again, hopefully, both people are wearing a mask, which significantly decreases the risk. As far as expectations around contact tracing, we do contact tracing at the state level, but we do look to event organizers to assist us in that. So just knowing who that person worked with and who they potentially, interacted with. And it's not going to be every person that came up and like got, a plate of food from them, for example.
So speaking of food, another food question here. Is buffet food completely out? Just need to hit that food advice and make sure people know if it's really ill-advised, is that a pretty hard and fast thing?
So I don't think it's completely out. We do know that this is a respiratory virus. You're getting it from the air, from people coughing and talking and breathing and singing, around you. It's not really that surface thing. Now, again, we always say we should be doing good hand hygiene always anyway. But I think having the hand sanitizer there, allowing the buffet, people moving through. I think especially types of buffets where you have someone there that is serving as people go through, as opposed to the self-service, is also, a good way of doing it. So no, I wouldn't say that it's completely out.
Talk a little bit about just public relations. A lot of organizations are worried about a backlash for putting the safety precautions in place. What do you recommend as far as organizations communicating to their patrons and prioritizing those things in their operations? Are there places or good examples that you've seen of communicating things in a positive way that you could point people to?
Oh man. I think the best thing, honestly, is like, this is how we get to do fun things, right? If we want to get together, if we want to go to the concert, if we want to, do whatever event it is, then we need to, protect ourselves and each other, right? If you don't want to abide, then, you don't get to participate. It is very hard, and I definitely sympathize with people. I think it's communication early and often exactly what your expectations are going to be, and then what will happen if people don't comply, right? If we make the rule that this is a mask required area, if you're not wearing a mask, we're going to ask you to leave, right? I mean, I think just being very upfront with what your expectations are, so there's no surprises and people know what they're getting themselves into.
Well, let's turn to kids for a minute. So, so if you're doing an art event that has serving young children, any special precautions or considerations? Are there indicators organizations should be looking for to determine if they should cancel in-person events, especially with children?
You know, I don't know if there's anything specifically with kids. You know, for the most part, kids are good about, they know that that if they wear their mask, they get to do fun things, right? I mean, that's you know, how a lot of them got to be back in school and you know, other events in their lives. So, I mean, good question, hard question. I think just constantly evaluating what's going on. I mean, I think especially if you're holding an art event in a town, for example, and the schools have had to go virtual, right, because of so many cases or something like that, that would be something I'd be communicating with. You know, it's always a good thing too to be talking to your local health department, right, to be kind of gauging what's going on. They know the information, right? Maybe they're not virtual yet, but they have like 3 or 4 classes that are out, et cetera. That might be something important for you to be aware of.
Again, you're not a futurist, and so I know you can't predict the future here, but you know, we're seeing numbers in our state and all around the country that are similar to, you know, what there were in maybe January of last year. But here we are in September, which is, you know, outdoor still time of year and not cold weather, etc. Any thoughts about, as especially arts organizations launch their seasons, which tend to, you know, get rolling in the fall and obviously go into the winter months, and most of what they have to do then moves inside. Do you envision that, you know, that some of the sensitivity is going to need to increase because, you know, we are at numbers in late summer that we were at in the middle of the winter last year? And how does that go into public health thinking as far as you're concerned?
Yeah, so I will say we have not seen any seasonality with this virus, right? Like we do flu, right? Flu, we always know, is in the fall, winter, late fall, winter. I will say, like, typically RSV, so respiratory syncytial virus, which we see causes most problems in little kids. We typically see that in the spring, and it's at its highest right now, which is unseasonable. And it's probably just because people moving around. What we've seen with the coronavirus is it goes in the waves about 2 months and 2 months, right? So 2 months up, 2 months down, 2 months up, 2 months down. And we suspect it'll continue to do that, unfortunately, with, you know, different variants, until, you know, more people are vaccinated or more people are exposed, and then maybe we'll see some things change. We did have a little bit of a peak in early fall last year, went down, and then it came back up again in the winter. So I suspect that's exactly what we're going to see here too. We'll come down in this fall time, and then it would go back up again. The other thing to keep in mind is that we don't know what's going to happen with flu. We're not seeing any flu. We don't know what happened to the flu. It's been really low, honestly non-existent in Indiana, in most parts as well. So that could also come back with a vengeance, just like we saw RSV come back with a vengeance this year. So please get your flu vaccine when those are available, and they are available in those pharmacies right now. Just, you know, because that's going to be probably out and about too.
For arts organizations that have retail spaces, how often should you be sanitizing surfaces and that sort of thing in retail environment?
I mean, I think, you know, just a reasonable amount. When it's dirty, clean it. If someone sneezes on your counter, clean it. But it's not like after every single patron that comes through, do you need to be sanitizing a surface. I do appreciate places where people are using pens to sign credit card receipts, etc. They have a kind of a clean and a dirty, because that's something that people are touching with their fingers over and over again. But other than that, just high touch surfaces, doorknobs, handles, several times a day. But no expectation it's once an hour or anything like that.
Talk about working remotely, going to arts organizations, administrative and whatnot. Is that still recommended where and when possible? I know there's pressure to kind of re-socialize and get people back together, and there's pressure to safeguard of people. So what's a good balance point, or what are the kind of considerations, at least in creating a balance point for working remotely?
I think right now, with cases being high and the transmission being so high, if you can continue to do things remotely and it's working for you, then do it, right? But in cases where people do need to come together, just make sure it's not all 20 people who used to fit in the same boardroom, right? Fine, very comfortably shoulder to shoulder around the board table. I would not do that, right? So smaller groups, or spacing, bigger space so people can have a little bit more space. Because even if everybody was masked, if you're shoulder to shoulder for an extended period of time, you are increasing your level of risk. But I mean, if you can work remotely for the time being, I would continue to do that until we see things start to go back down. Again, I think we're going to have to learn to change our behaviors based on the tide of what's going on.
So as you look kind of on the landscape of live events in our state and across America, are there some really good things that you've seen, and are there some really bad things that you've seen from a public health standpoint? And what would you point to as a really good some of the good best practices that you've seen for live events and larger groups of people out there?
Yeah. So yeah, I love live events. I'm happy to do all the things again with everybody else. I appreciate all the planning that people do and preparation for it, and feel for them when they have to pivot. But I think that's my biggest advice to people is plan for change, plan for something to be different, right? What's this going to look like if cases are high, transmission is high? What would it might look like when cases are low and transmission is low, right? And what can we do to go between the two of them? I think allowing for social distancing where able is definitely a nice thing. Do I think it needs, always like perfectly 6 feet between everybody? No, but just some space, right? Again, like that shoulder to shoulder, tight indoor event. Big, huge open spaces like the stadiums, et cetera. Again, not seeing huge transmission in those types of places, I think just because of the amount of air that's in there, but more kind of those closed, tight-knit places. So if you can give the potential for some space there is really helpful. And then if you, decide that you're going to have mask requirements, again, that's another just level of mitigation to help protect people from one another and to protect yourselves.
So speaking of spacing, would you recommend continuing to space seating at theatrical events? Like a lot of arts organizations and sports organization went to, okay, you buy a block of tickets, you can sit together, but then there has to be space between that purchase and the next purchase in some ways. That's still a good practice, or something that you'd recommend?
Yeah, I think that is continues to be a good practice. I mean, even if you're just like seating every other row, right? Because most people are, especially in a theatrical place, everyone's facing forward, right? And that is even a good practice to do. But I will leave how that all works out to you guys. But I think allowing some spacing is good at this time.
I think we're kind of at the end of the questions that have been posted to us. Is there something that we haven't covered that you think it's important for us to know as a sector with the kind of work that we do?
Yeah, as much as you can talk about and encourage vaccines, again, that's our are one way of truly, preventing significant illness, I would encourage you to do so. People who are hesitant are looking to people that they feel are like them, so colleagues, friends, to be the ones for information. So everyone who is going to listen to me has listened to me. I have to look to everybody else now to help carry that message. So the vaccines are absolutely safe, and they really, really, really are saving lives. This affects everybody. Even if you're vaccinated, all the people that are needing the hospital right now who are unvaccinated are affecting people who are in car accidents, people who have their appendicitis, people who have a stroke. Right, that stress on our hospitals affects all of us. If you go get vaccinated right now, you're going to start getting protection. In just 2 weeks, you're going to start building antibodies. So there's no time like the present. We are still waiting for more information about what these boosters mean and what they look like, but be paying attention if you are eligible for them here in this next month, and if what the recommendations are around that, just to kind of be prepared. But the more people we can get vaccinated and protected, the better place we will all be in, so that we can continue to do all these important events.
Dr. Weaver, thank you so much for, first of all, for the work that you're doing during this time, how valuable it is to everybody in our state. And we really appreciate the work that public health officials and our healthcare workers continue to do to make sure that we're safe. And also thanks for lending your wisdom to our sector, because it is a sector that lives by engaging people. And so we're really appreciative to have the advice that we can continue to do that in a safe fashion.
Thank you. I really appreciate the opportunity. Thank you all for what you're doing. I know that this has affected you all, especially this last couple of years. So I hope that we continue to be able to have events and do the arts in a safe way. So thank you.
Take care and thanks again. Bye-bye.
Bye.